Welcome to today's session on ICD 10cm Chapter 15. We will be deep diving into the coding guidelines for pregnancy, childbirth, and the puerperium, covering the code range 000 to 09A. This chapter is vital for anyone looking to master medical coding, as it involves specific rules that differ from other chapters. Let's step into your success with Visu online medical coding training. To start, let's look at a high-level overview of Chapter 15. These codes are strictly reserved for maternal records. You should never apply them to a newborn's chart. Whether it is a perfectly normal pregnancy, a minor complication, or a major obstetric emergency, this chapter covers it. A key rule to remember is that Chapter 15 codes almost always take sequencing priority, meaning they are listed first on the claim in most maternal cases. Understanding the timeline is crucial for accurate coding. Antepartum refers to the time before birth, while intrapartum is the period during labor and delivery. After delivery, we enter the postpartum or puerperium period, which lasts for 6 weeks. We also use terms like gravida for the number of pregnancies and parity for births beyond viability. Additionally, keep an eye on the peripartum period, which spans from the last month of pregnancy through 5 months after delivery. Let's break down the chapter into its major blocks so you can navigate the code book more easily. We start with 000 to 008 for abortive outcomes, followed by 009 for high-risk pregnancy supervision. Hypertensive disorders fall under 010 to 016. The delivery itself and its complications are found in the 060 to 082 range, and finally, 085 to 090 to handle complications that arise during the postpartum period. Trimesters are a defining feature of obstetric coding. The first trimester is up to 14 weeks and 0 days, the second goes from 14 weeks up to just under 28 weeks, and the third starts at 28 weeks until delivery. Your assignment of these codes must always be based on what the provider has documented in the medical record. If the trimester changes during an admission, we typically code the trimester at the time of admission. Now, let's discuss some general coding rules. Since Chapter 15 has sequencing priority, it comes first, followed by codes for specific conditions, and Z3 are codes for the weeks of gestation. Note the difference for incidental pregnancy. Use Z33.1 only if the doctor explicitly states the condition being treated has no effect on the pregnancy. Also, remember that a Z37 outcome of delivery code is mandatory for every maternal record where a birth occurs. The Z3A category is used to identify the exact weeks of gestation. Think of this as a secondary detail that completes the picture. For example, if a patient is 24 weeks pregnant and has anemia, you would first code 099.012 for the anemia complicating the pregnancy, and then add Z3A.24 to specify that she is exactly 24 weeks along. The Z37 codes, or outcome of delivery codes, are only used on the mother's record and only once per delivery admission. They tell us what happened at the end of the encounter. For instance, Z37.0 indicates a single live birth, while Z37.2 would be used if twins were born and both were live born. It's a simple but vital piece of data for health statistics. Not every pregnancy involves a complication. For a routine checkup during a normal pregnancy where everything is progressing as expected, we use category Z34. For example, Z34.01 would represent the supervision of a normal first pregnancy during the first trimester. These codes are used only when no complications are present. When complications do arise, we move into the O codes. These range from gestational hypertension and diabetes to infections. Category 010 to 016 covers hypertensive disorders. 020 to 029 covers other maternal disorders like hemorrhage or anemia, and 030 to 048 is where we find codes for maternal care related to the fetus or the amniotic cavity. Sequencing is the most common area where learners make mistakes. The golden rule is obstetric code first, then the code for the associated condition, and finally the weeks of gestation. For example, if a patient at 28 weeks has pneumonia, you code the respiratory disease complicating pregnancy, O99.513, then the specific pneumonia code, J18.9, and lastly Z3A.28 for the weeks. Gestational diabetes is another common scenario. We use the O24 category, which distinguishes between diet-controlled and insulin-controlled cases. If a patient is 30 weeks pregnant and using insulin for her gestational diabetes, your primary code is O24.414, followed by the weeks of gestation code, Z3A.30. Hypertensive disorders like preeclampsia and eclampsia are very serious. Preeclampsia involves high blood pressure and signs of organ damage, like protein in the urine, usually after 20 weeks. Eclampsia is even more severe, involving seizures. For a patient at 32 weeks with preeclampsia, you would code O14.93 for the third trimester and Z3A.32 for the weeks. The O20 to O29 range covers various maternal disorders. This includes things like severe morning sickness, known as hyperemesis gravidarum, as well as hemorrhage and anemia. For instance, a simple case of mild hyperemesis gravidarum would be coded as O21.0. These codes ensure that the extra care required for these conditions during pregnancy is captured. Now we move to abortive outcomes, found in O00 to O08. This includes ectopic pregnancies, where the embryo implants outside the uterus, like in the fallopian tubes, and spontaneous abortions, commonly known as miscarriages. For a tubal ectopic pregnancy, the correct code would be O00.10. In cases of a spontaneous miscarriage without further complications, we use O03.9. This chapter also handles high-risk pregnancies under category O09. This is for patients who need closer supervision due to factors like advanced maternal age, over 35, a history of C-sections, or previous obstetric issues. An example would be O09.522 for an elderly multigravida in her second trimester. The puerperium period, the 6 weeks following delivery, has its own set of complication codes. O85 is used for puerperal sepsis, a serious infection, while O86 covers other postpartum infections. O90 is a catch-all category for other complications of the puerperium that don't have a more specific home in the code book. Preterm labor, coded under O60, occurs before 37 weeks and is marked by contractions and cervical changes. On the other end of the spectrum, code O80 is used for a perfectly normal delivery, one baby, no complications, and a vaginal birth. We also have codes for procedures like C-sections or forceps delivery. Look at our example here. For gestational diabetes at 32 weeks, we use O24.414 to capture both the condition and the trimester. Let's look at a few more examples. When a patient is admitted for a completely normal vaginal delivery of a single live baby, we simply use O80. If the case involves a tubal ectopic pregnancy, as we mentioned earlier, the code is O00.1. These examples show how the codes directly reflect the clinical reality of the encounter. Now, let's test your knowledge. Can you identify the code range for Chapter 15? Do you remember the definition of the puerperium or how long each trimester lasts? Think about which codes represent a normal delivery versus an ectopic pregnancy, and how you would describe preeclampsia. These are the fundamental questions you'll face in certification exams. Before we wrap up, here are some expert tips. Always check for the trimester and weeks of gestation. Note the updated HIV guidelines for 2026. Only use O98.7 for symptomatic HIV. Also, a very important rule: do not report BMI codes, Z68, on maternal records. Finally, be aware of the 2025 social determinant codes, which help capture factors like insufficient insurance that might impact care. In summary, remember that Chapter 15 codes are for mothers only and usually take sequencing priority. Accuracy depends on correctly identifying the trimester and weeks of gestation and having clear documentation from the provider. Thank you for joining Visu online medical coding training. Keep practicing, and you'll master obstetric coding in no time.